This is my life as a doctor in a resource-limited health facility. Every day, I face difficult decisions as we work tirelessly to save lives. Severe community-acquired pneumonia is among the major causes of admission and deaths in children under 5 years. It's a disease that puts both families and health systems under immense pressure. Your child has severe pneumonia. We need to admit him for 5 days to give him oxygen and put him on antibiotic injections. The current WHO guidelines recommend 5 days of injectable antibiotics for severe pneumonia. While effective, this approach is not without challenges. Longer hospital stays are more expensive, affect the well-being of children and their families, and place a higher burden on healthcare facilities. Furthermore, keeping children in hospital increases their risk of picking up further infections in hospital, including those caused by resistant bacteria often encountered in hospital. The Pedicap trial explored a child-centered approach to address these challenges by switching children from antibiotics given by injection to antibiotics given by mouth. Once they improve and are able to take fluids and medicines orally, the time the child has to stay in hospital can be shortened and the burden on the family is reduced. The Pedicap trial, funded by the EDCTP and sponsored by Penta, was conducted across 5 African countries: South Africa, Uganda, Zambia, Zimbabwe, and Mozambique. Enrolled over 1,100 children with severe pneumonia aged 2 months to 6 years. The research explored a safe and effective transition from injectable to oral antibiotics once a child had clinically improved and was able to take oral antibiotics. The trial also compared switching from injectables to 2 readily available oral antibiotics, either amoxicillin or amoxicillin clavulanate. The results of the trial showed that an early switch to oral antibiotics was safe and equally effective with 2 critical benefits. Children needed to stay in hospital on average 1 day less, and the trial established the safety of short treatment duration with this early discharge approach. The study also showed that switching to oral amoxicillin was equally as effective as amoxicillin clavulanate. The study found that a total of 4 to 5 days of antibiotic treatment, including both the initial injectable phase and the subsequent oral phase, is sufficient for recovery. This allows for early discharge from hospitals, on average 1 day earlier compared to the current WHO recommended regimen, reducing the strain on families and healthcare systems. At first, I was skeptical. Could children who were so ill when admitted really recover fully after switching to oral antibiotics? But as we implemented the trial, the results spoke for themselves. It took time to build confidence among doctors, but the results were undeniable. Children recovered well, families were relieved, and hospital resources were better managed. Shorter hospital stays means less disruption of families and fewer financial burdens. Amoxicillin and amoxicillin clavulanate are equally effective, and amoxicillin is the World Health Organization's recommended oral antibiotic to treat pneumonia in children. It is affordable, effective, and easy to administer, as it is also available as a dispersible tablet. Children can be cared for at home, reducing the need for prolonged hospitalization, which translates to cost savings not only for parents but the healthcare system as well. Dr. Constantine Mutata said, "Parents appreciate the simplicity of dispersible tablets. They are easier to store and transport, and children don't find them bitter." Pedicap is a game changer for how we treat severe childhood pneumonia. This safe, effective, and affordable treatment strategy can lead to significant improvement in patient care, healthcare resource management, and antibiotic stewardship, paving the way for better treatment outcomes for children with severe pneumonia. Pedicap was sponsored by the Penta Foundation and funded by the EDCTP.